Good afternoon. I'm Linda Parks. I'm on the Ventura County Board of Supervisors, and on behalf of my full board, Chair Kelly Long, Supervisor Bob Huber, Matt Levere, and incoming Supervisor Carmen Ramirez, I want to wish you all a happy new year. And I also want to urge you to please not gather for New Year's. By not gathering, you will limit what is anticipated to be the deadliest time of COVID during this whole pandemic. We're taking excellent measures to prevent the spread, lots of ventilators, hospital surge plans, but to the best of our abilities, too many patients will reduce our ability to provide the care that they need. So we please urge you not to gather. Well, we're really thankful that the vaccines are here in our county, and it is truly a light at the end of the tunnel. And this is our last press conference of the year. Tomorrow is New Year's Eve. And I want to do some thanking. I want to thank our American Sign Language interpreter, Kelly Turner, our Spanish language interpreter, Lourdes Campbell. Thank you both. And all of those who have been presenting up-to-the-minute updates at these press conferences. I also want to thank our Environmental Health Department under the fine leadership of Kim Prilhart, who has provided what we call ambassadors to help our small businesses to meet the requirements of the state. I'm also glad for the money that's coming from the federal government for those small businesses, as well as from the state. And our county, with our CEO's leadership and our Board of Supervisors, has already been able to provide close to $24 million to our small businesses. We've also been able to waive a lot of permit fees for those businesses in the amount of about $1.6 million. I am also really thankful for our public health professionals. Each press conference, I think we've had Dr. Levin here and Rigoberto Vargas to give us up-to-date information on what we need to do to best protect ourselves and our loved ones. 935 healthcare workers have contracted COVID over the course of the pandemic. Nurses and doctors, hospital staff. We've also had 506 farm workers contract COVID. And I'm also really thankful for our Farm Workers Resources Center. And this center, which was established prior to the pandemic, has come in very useful in being able to quickly contact farm workers, provide them the education they need, testing, and some financing too, and the ability to isolate when they need to by providing them some shelter. I'm really thankful to the angels who work with our senior citizens who are homebound and can't see their family members. So good to have you there for them. I'm also awed and thankful for the amazing rollout of testing that our county has done. We have tested 680,000 people, or given 680,000 tests, but when you think that our population in Ventura County is only 840,000, that's a significant portion of our population that has been tested at our county facilities. I'm also really thankful to Victoria Jump and the Area Agency on Aging and their staff and volunteers. They have delivered 2.9 million meals, 2.9 million meals over the course of the pandemic. Through the Great Plates program, we have been able to get restaurants $30 million to provide those meals. So much has come together, and I'm so proud of our staff. Tara Caruth has assisted with our staff in providing shelter for people who are experiencing homelessness. Over the course of this pandemic, we have put more people in shelter than I think we ever have in the history of our county. Thankful too to our new OES director, Patrick Maynard, who helped us with getting those hotels to assist with that sheltering. I'm also really thankful to our first responders. 104 first responders have contracted COVID over the course of the pandemic, including firefighters, peace officers, and paramedics. But beyond our county family, really thankful to the churches and synagogues and mosques that have stepped up to help our vulnerable populations who are made even more vulnerable because of the pandemic. And to our grocery workers, who I'm sure never in a million years ever thought that their jobs would be considered essential and risky that they have become. 360 grocery workers have contracted COVID during the pandemic. I'm also thankful to private donors and public funding for those COVID vaccines that are the light at the end of our tunnel. I'm thankful to Dr. Fauci's team, including a 34-year-old African-American woman scientist who was integral in getting those vaccines developed. Her name is Kizzmekia Corbett. And not only has she been a role model for others to become scientists, but she has devoted herself now to ensuring that people in the African American community, which is one of the hardest hit communities, get vaccinated. These and many, many others deserve our appreciation and our respect. And whether it's helping society or just helping your neighbor by wearing a mask or providing assistance, we as everyone have an ability to assist and make a positive difference. I want to thank everyone who wears a mask. I want to wish you good health. I know that we have, as a county, come together. I recall, too, that some $33 million was spent in providing rental assistance for people who would otherwise be evicted. Coming together in times of crisis is Ventura County Strong. And I want to now thank everyone and also introduce to you our lineup for today. Dr. Robert Levin, our Public Health Officer, followed by Dr. Tara Paterson, who helps oversee our ICUs, and Barry Zimmerman, our Deputy Director of our Healthcare Agency. Wishing you all a happy new year. Thank you very much.
Thank you, Supervisor Parks. Good afternoon, everyone. First, my name's Dr. Robert Levin. I'm the County Health Officer. First, I'd like to update you about some of the numbers. We're reporting 400 new cases today, and these were from 4,355 people who were sampled. That's a 9.2% positivity rate. Our case rate for the week ending a week ago was 70.3, but what that translates to is 598 new cases diagnosed each day during that week. For the week that ended about 3 days ago, our number was down to about 556 new cases diagnosed each day during that week. And again, today we're reporting 400 new cases. And I think this is cause for optimism. That is only 1 point on the curve. But I also like to point out that the test positivity rate, meaning what percentage of all the people tested turned out positive, during that same week, a week ago, it was 11.4% on a daily basis for that week. And today, 1 point on the curve, again, only, it's 9.2%. I do have 5 new deaths to report today, and that brings us to a total of 260 deaths. And I've said this before, when this pandemic began and it was predicted that we would have between 250 and 1,000 deaths in our county, I thought to myself, we're never going to have 250 deaths. And the reason was, I knew that we would take the steps, the actions, practice the personal responsibility that would keep us from getting there. Remember the flu season that we had 3 years ago? Most deaths we ever had, 49 in a quarter of a century. I was thinking maybe we'd have between 50 and 100 deaths. We are at 260 deaths. And frankly, we didn't need to be here. This is the highest month ever that we've had, with 56 deaths alone in December. The case fatality rate, however, let me go back a little bit. All right. So this points to the new cases reported each day. And this speaks to the fact that we had 400 cases today, down from a peak earlier in this current surge. And this shows the 56 deaths that we've had so far in December compared to previous months. Our case fatality rate is now, like November's, down to 0.4%. And there's probably 2 reasons for this. One, and I'll be introducing someone who's playing a pivotal role in this next, our ICU docs are getting better and better at managing patients with COVID. But I think the other thing that is influencing this is the fact that more and more people are going out and being tested, people with fewer symptoms, people with a contact with someone who had COVID, people with no symptoms at all. And that can also affect this number, but this is a very positive development. So there's reasons both to be optimistic and pessimistic. Reasons to be optimism. A reason to be optimistic is the case rate, I told you, seems to be falling. The positivity rate, the number of tests that are positive every day, seems to be falling. The other thing that seems to be improving, which is to say increasing, is the doubling time. The doubling time is the number of days it takes to double the cases that we're having. A couple months ago, this was at 200 days it took to do this. It's more like 3 months ago. And this saw a precipitous fall as this surge occurred. And we were down into the 20s a week or so ago. Well, now we're creeping back up, and we're at 44 days doubling time. Another sign of optimism, another reason to be hopeful that our actions are curtailing this surge. Now, pessimism. I hate to use this word in association with pessimism, but I will. Christmas. We have not seen the effects of Christmas yet. We will next week. We won't see it in our numbers of people who are hospitalized. We won't see it in patients on ventilators. We won't see it in deaths, but we will see it in the number, the case rate, which today was 400. If we did a good job over Christmas at social distancing and staying home, that 400 will stay the same or fall further. If we didn't do a good job, we're going to see a continuation of this surge with just that minor hitch in it that I'm describing right now. The hospital census today across the county is greater than 900. In fact, it's 937. And all of November we did not have a day over 800. Again, today we're at 937. There was a time not too long ago when 8 of those patients across the county had COVID. Today, 375 of those 937 patients are in the hospital with COVID. 70 are in the ICU, and that's a total of 107 occupied ICU beds, 70 of the 170. So, okay. So imagine a curve. Well, I'll tell you what, I'll skip ahead and show you this. This is a curve of the first wave of the pandemic, and this is the second wave of the pandemic. This is not our graph for us and our county and our state today. This is from 102 years ago. When I first looked at this 9 months ago, I saw that first blip, and I really didn't see the rest of these two curves. The reason I didn't is I thought we were just too evolved, too intelligent to let that second curve happen again. I thought the steps we took would be taken in unison as a population, as a group of people who work together. But not all of us have. There have been gatherings. This is a disease that spread person to person. And that second curve is really accurately reflecting what is going on right now. Now, about 2/3 of the way up that curve, and the middle one is where we're at right now. And we're showing a flattening, as I just said, right now. We may continue up on this curve if Christmas activities dictate that we do so, but we could have flattened out and headed down on this curve. And then if we look at that third curve, which I won't ignore this time, that's destined for late spring or summer ahead of us. Now, the thing that they didn't have 102 years ago was vaccine. We've got vaccine now, and it's going to start having an impact, and I hope it modifies and maybe even does away with that third and final curve. We'll see. Our behavior alone could do away with that third and final curve. So let me explore a little bit vaccine that we do have. First of all, rolling out this process of vaccination is not clean. It's not as organized as we want it to be. We are doing our best, and I think it is very organized, but it's not perfect. We've never seen a rollout of vaccine like this. It's limited by the fact that the quantity of vaccine that's coming through is small at this time. It will get greater as we go on through the weeks. But let's look at our different phases here. Those are they on the left. And let's look at what populations are going to be immunized when. We are pretty much through phase 1 already with the vaccines that we've received. The hospital staff, and that includes everyone at the hospital, the housekeepers, the phlebotomists, the nurses, and the doctors. All the hospital staff across our county and our 8 hospitals are either finished being immunized or almost finished being immunized. Our medical first responders are our paramedics and our EMTs. Our long-term care staff and residents are undergoing vaccination right now, and this is a critical population to protect us. This is where the greatest mortality rate is that we're seeing. I can go back for just a moment and point out that the case fatality, when I spoke about the deaths before, previously the deaths in our county had been running about 28% of those deaths were from our long-term care facilities. And I think we were probably one of the best counties in the state. The rest of the state was moving along at about 40% of a case fatality rate. And what that means is case fatality rate, it's not the case fatality. The percentage of people who were dying in this county who were from long-term care facilities was 28%, and the rest of the state 40%. Well, now we are at 42% or almost 42% for December. We're seeing an increase in the number of people from our long-term care facilities dying. I don't think that means we're catching up with the state. My guess is when all is said and done, we'll find that the state is at a rate of 50% or more. So we're still behind the state and doing a good job protecting our elderly in our long-term care facilities. Let me continue with this, and that is in this phase, we're also immunizing other healthcare providers, and that's clinics and staff, and we're starting to do that right now. Then we move on to phase 1B, and this says early February to late March. The state has said optimistically this might happen as early as the middle of January. Critical infrastructure workers include our farm workers, include our workers at grocery stores. Law enforcement and firefighters will be in this tier. The education sector will also be in this tier. And then people 75 years of age and over. And then after phase 1B and phase 1C comes all older adults, not included in phase 1, and that means people 65 to 75 years of age, 74 years of age, whether they have a comorbidity or not, and people with high-risk conditions. And that means anyone from 16 to 64 years of age with some kind of medical problem will also be immunized during this period of time. And this will occur again after the completion of phase 1B. After 1C is completed, we go into phase 2. And that is all other people in the county, 16 years of age or older, and not already immunized. Now, the reason we're talking 16 is these vaccines are only approved for 16 years of age or older. And luckily, people under 16 tend to do very well with this virus. And so those are my comments for the day. I would like to introduce Dr. Tara Paterson. She's the emergency medicine and critical care physician from Ventura County Medical Center, ICU co-director as well. And have a Happy New Year. And please don't gather. Stay home. Thank you.
Thank you very much. Thanks for having me. So I just wanted to start off by saying thank you so much to the healthcare providers and the healthcare workers, including dietary, janitors, nurses, physicians, medical students, residents, nutrition, everyone who puts their life on the line every day and comes to the hospital and cares for the sick and dying and those patients who have contracted COVID. So from an ICU and emergency perspective, as you've heard, the numbers are at an all-time high in the intensive care units throughout Los Angeles, throughout Ventura County, throughout all of California. And we are imploring you to do your best and do your part and help us provide the best possible care for those who get sick and get COVID, and also come into the hospital with other illnesses. And in order for us to provide the best possible care, we need you to do your part. And as you've heard numerous times before, that includes wearing a mask, social distancing, and not gathering. And please, if you have any symptoms at all, quarantine yourself and get tested. We have had numerous patients in the ICU who have continued to work even though they felt ill. And they come down with COVID-19, and then they infect the numerous people that they work with. Also, people who've had some signs and symptoms continue to gather with their family, and they don't quarantine. We've had one instance where we actually had 3 family members at the same time in the intensive care, all with COVID-19. So again, please do your part. We continue to be hopeful, and we continue to learn about COVID-19 on a daily basis. The amount of literature and articles and research is astounding, and we are so thankful for the people who continue to do that research and help us take better care of you. However, there still is no cure for COVID-19. It is just supportive care. We have some medicines that will help change the duration of the illness and may help mortality. But again, we do not have a cure for this disease. Patients in the population who are 45 years and older over these past 10, 12 months are more likely to die, 45 and older, are more likely to die of COVID-19 than a motor vehicle accident, homicide, or suicide. This is a disease that knows no boundaries. It affects the young, the old, and increasingly even children, as opposed to before where we thought they were not as susceptible to this disease. I'll give you an example of one patient who will be ingrained in my mind forever. A 40-some-odd-year-old patient who died the week before Christmas of COVID. He said goodbye to his wife. He wrote letters while he was in the hospital, and he knew he was going to die when he was placed on the ventilator, and he did. These patients who are so sick that they need mechanical ventilation, a large portion, a majority, depending on what you read and depending on where you practice, anywhere from 40 to 80% of those patients who wind up on a ventilator die. They do not make it out of the hospital. So again, please help us take the best care possible for your loved ones, for yourself, and for your community. We're hopeful that hopefully the numbers continue to go down. People are abiding by the stay-at-home order that's in effect in California, and more people are really taking this to heart. We're hopeful that there's the new vaccine, and a majority of the healthcare providers, at least at my hospital, have already received the first dose of the vaccine, and hopefully it will become more available to the public. And we're hopeful that 2021 will be a much better year than this past one. So again, please do your part. Please make small sacrifices by not gathering so that you don't have to make the ultimate sacrifice and endure the suffering from COVID-19. So let's all give ourselves something to be hopeful for in 2021. Thank you. I would like to introduce Barry Zimmerman. He's the Deputy Director of the Healthcare Agency next. Thank you for your time.
Thank you for those powerful remarks, Dr. Paterson. I'll give you a brief update on the testing status today. As many of you may have been tested, testing volumes are high. And as of yesterday, we had our highest daily volume at our county-operated sites, with more than 6,400 individuals being tested. Today, all our sites are fully operational as scheduled. To remind you that we have many different access points for testing throughout the county. Let me just remind you of those locations. We have a walk-in location at the Ventura Fairgrounds, a drive-through site at Santa Paula in the city of Santa Paula, at the Oil Museum parking lot, a drive-through site at Oxnard College, a new site at Camarillo at Freedom Park, and that's a drive-through site. Moore Park College is a drive-through site. And we also have 2 state-operated sites at the Oxnard Performing Arts Center and at Newberry Park Library that are available for you to freely go and be tested. As reported prior, we've had some supply chain issues. We have remedied those and incorporated additional capacity into our testing system. As a result, all our testing locations should be fully operational 7 days a week now, as scheduled. The only exception is with the county fairgrounds is open 6 days, with Wednesday being closed. And on that closed Wednesday, a mobile site will be available at Community Park. That's at Kimball and Telephone Road. I'd like to make you aware, as we've incorporated a new laboratory into our testing system, we are requesting at those sites to pre-register or to go online prior to you showing up at the testing facility. This will allow us to have greater throughput and simplify the process for you to receive a test. Those locations that we encourage and highly encourage pre-registration are at the Camarillo site, the Moore Park College site, as well as the Oxnard College locations. Many of you have already pre-registered and gone through that process. We just remind you that to pre-register will make it an easier process. You can register at vccovid.com, and the registration process is both in English and Spanish. For all available information related to testing, please visit the county website at venturacountyrecovers.org, and there you'll able to see the latest status of all testing locations. In addition, test wait times are listed throughout the day, and there are links to the pre-registration site from that web location. We recognize that the volume of testing is high, and therefore wait times have been extended and are long. We are working to remedy that as best we can, but we just understand that there is a lot of demand at this point in time. With the increased laboratory capacity, we anticipate and are seeing that the turnaround time for results is improving. And so we would hope within the week, as we catch up on the lab capacity, that we will back to an acceptable turnaround time within 48 hours for your test results. As a reminder, these are outdoor locations. The majority of them are outdoors, and therefore weather does impact the ability to operate them safely and with the integrity needed to do the sampling. So on those days where we have experienced, not often here in Southern California, but rain and wind, that we might have to alter the schedule of our testing locations. So on days in which we are experiencing a weather event, please visit Ventura County Recovers.org for the latest status of those testing locations. We remind you that testing is one of the strategies in order to help combat the spread and infection of COVID. We hope that if you have experienced any symptoms or have been exposed to get tested and to follow the precautions to prevent further spread. We hope that by being tested will give you the information you need to act responsibly and accordingly to prevent the spread. Testing is not a fail-safe option to then do whatever you choose to do without taking precautions. With the upcoming holiday, many are being tested to see your current status, and we welcome that. But we also encourage you that does not mean that you are free to gather and to have events that you otherwise would not have within your household. So we encourage you to continue to take access of our testing resources, which are plentiful and are under high demand, so you can help us prevent the spread of COVID. I remind you that your personal actions to prevent COVID are more impactful and can have a lasting impact in the trend of our case rate. I hope that you have a safe new year, that you celebrate accordingly and safely within your house, that we do it remotely where we can, and be in touch with people remotely so that we can have a more joyous 2021 in which we will be able to gather together and celebrate our holidays and our special events. I thank everyone for their efforts and conclude this final conference for the year, and be safe. Happy New Year.